two ways of examining the voice box, either through a flexible scope that goes through the floor of the nose and round, or a direct through the mouth using a rigid that scopes there. So in England, in UK, most people will use the flexible, so it goes through the nose, okay? But whether you do the flexible or the rigid, it can be either a continuous light, cold light, or stroboscopy. So stroboscopy just refers to the type of light that's shining whilst you're examining the larynx. And with a cold light, it just shines a continuous light down onto the voice box. So you can see the vocal folds come together like that, but you can't see the mucosal wave. So you can see the gross movements of the vocal folds. With stroboscopy, what happens is it shines a flashing light down onto the vocal folds, and it shines that light, it flashes slightly out of sync with the vocal fold vibration. So the impact of that is it looks like you're seeing a slow motion version of the vocal fold wave, okay? You're not. What you're actually seeing is flashes of light at different points in the vocal fold cycle, but it gives the impression of a slowed down mucosal wave. And the really important part of that is that if there is any lump or bump under the surface of the vocal fold, so like a cyst, for example, you will see an area that isn't vibrating properly. You might not see that on cold light. And it's the same for a sulcus. You may not see a sulcus using cold light, but you will with stroboscopy.
You mean
so
you
really
we can diagnose sulcus and cyst with laryngoscopy, cold light?
Sometimes you can. Yeah, so sometimes you can. Sometimes you'll see a really clear sort of egg shape on the top surface of the vocal fold. But most of the time, and to be more certain, you need stroboscopy, okay? So it's much more clear what you're dealing with. And obviously, if we know what we're dealing with, we know what we're treating. We know how to manage that better. So in the UK, we always say that patients really should have stroboscopy. They don't always. We have clinics in the UK that don't have access to it as well, but we would always recommend that a patient should have stroboscopy.
You mean in Britain you don't use laryngoscopy, cold light? Am I right?
Some people do, yeah.
Some people do. Okay.
Some people do, and some people, some people will not have access to it, and some doctors will also not know how to use the stroboscopy or not know how to interpret it and may just use cold light. So it does. So we still have, many centres where it doesn't. In our voice clinics in Nottingham, we will always use stroboscopy.
Okay. So you recommended in voice therapies to do a stroboscopy?
Absolutely, because then you know what it is that you're dealing with, and working out that differential diagnosis is so important.
What about professional voice users?
100%, absolutely. For a professional voice user, it is so important to get that diagnosis right and to check that there's no subtle lesions or subtle structural problems. So the British Voice Association will, that they strongly recommend stroboscopy for a voice clinic. For any voice clinics in the UK, they should have stroboscopy available to them.
They should have a stroboscopy.
They should, but it's not, as you've said, it's not always possible. Funding isn't always there. It's not just good enough to have the light. You need to know how to interpret what you're seeing. So there's issues around training as well.
Yes.
But this is, the facts are that it will give you a much clearer picture, and you'll be able to diagnose lesions that you wouldn't be able to if you didn't have it.
Exactly. I wanna ask another question about the stroboscopy because it's my favorite topic. In Britain, every SLPs can do a procedure, or you have a protocol for doing استروبوسکوپی for SLPs? What is the rules? What are the rules?
So in the UK, you have to undergo training after you've graduated to be able to carry out nasendoscopy or laryngoscopy. So that is postgraduate training, and there's a competencies that are set by our Royal College of Speech and Language Therapists, the RCSLT, to guide somebody through that process, because it's not just about the physical aspect of putting a camera down somebody's nose. It's knowing how to do that safely, when to do it, when to not do it, some of the contraindications, and then also what you're looking at and interpreting what you're seeing. That's the really probably the more complex aspect than physically putting the camera down. It's interpreting those images, and that's something that takes time to learn. So absolutely not all speech therapists will do it at all. It's a separate process that you need to learn to be able to do, and have the right supervision and support in place to do that.
Okay, it's unrelated to your curriculum, your college curriculum. I mean, when you graduated from your university, you didn't have any education for that?
No. So when you graduate, there are so many different areas that you can go into as a speech and language therapist, as you know, that you cannot possibly know everything there is to know about all the different areas. And no, you do not come out knowing how to undertake stroboscopy, just like you wouldn't come out knowing how to change tracheoesophageal speaking valves in a patient or anything like that. These are all postgraduate skills that we would need to go on courses and learn how to do.
Okay, is there any limitations for your SLPs? I mean, for BSc, MSc, is there any limitation, or you can just pass some courses or some protocols to do stroboscopy?
So it's not a sort of degree like the speech and language therapy degree are, but there will be organized courses that are aligned with, and probably one of the best things is to share with you our Royal College paper on this, which gives so much more information than we have time to go into today about the sort of prerequisites, so things that speech therapists should be able to do prior to doing it, and the competencies and how to develop those, and the different levels of endoscopy, and the different types of clinics that a speech language pathologist might take part in or might run when they're doing endoscopy, because it may be for assessment, it might be for treatment, it might be intervention clinics, but there's huge amounts there to talk about, and it's all in the Royal College position paper, so that may well be a useful resource to share.
Yes.